At the Mays Cancer Center, we have about 15 clinical trials that are open that cover GI malignancies or that can be offered to patients with gastrointestinal malignancies. These include cancers such as colon cancer and hepatocellular carcinoma. And the types of trials vary depending on the stage of the cancer a patient has, as well as if they're looking for new therapies or we are looking to test a prior therapy with a novel therapy, which is more of a phase 3 clinical trial. We also have trials that are looking at survivorship and biomarkers, looking for early signs of recurrence as well. The benefits of participating in a clinical trial at an NCI-designated cancer center are great. So first of all, you have access to new therapies that are not otherwise available. You also have an entire research team that's working with you from the beginning of learning about a trial and helping you get through the trial and the treatments. And so you have an extra team outside the clinical team that makes sure that you're doing okay during the treatment. In general, patients who are enrolled on clinical trials have better outcomes. And sometimes it's directly related to the new treatment that they're on, but oftentimes it's because there is a whole research team that is making sure that the patient gets to their appointments, has the support that they need to be on treatment, and to follow up on the imaging and biopsies, et cetera, that are needed. And so having that extra layer of support tends to have better outcomes. Sometimes there can feel like there's some barriers to being on a clinical trial, and one of them can be, how we think about clinical trials. Sometimes patients ask me, am I going to be a guinea pig or am I going to get a sugar pill? And those are all great questions. So those are things that you should talk to your oncologist about. But oftentimes, clinical trials are designed with the patients in mind and to give them the best opportunity. And so we only want to offer a trial to a patient if it's going to help them. And if we have a treatment that's available outside of a clinical trial, we're going to offer that as an option as well, so that you have a choice to decide if you want to receive standard therapy or a newer treatment on a clinical trial.